The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD Warriors. We are gathered here for the next episode of TMD Demystified, and I am Tony Urbanic. Today, as promised, I am going to do a little self-celebration and share it with you. I hope that you'll get something out of it. I think you will. I had to spend a little time figuring out what I wanted to do for the 100th episode of TMD Demystified on Dental Town. I had some options, but ultimately, although it took a little technical work to figure it out, that I put together a program on the computer which identifies a significant number of our patients who avoided surgery and had significant damage to the temporomandibular joints and actually avoided surgery. And we're going to document and talk about that a little bit today, because the backstory goes like this. If this is your first time listening to me, I need to get the backstory, but if you're one who watches these episodes routinely, you already know what I'm going to say. 12 years ago, I decided that after 30 years of doing temporomandibular joint procedures, surgeries on the temporomandibular joint, I decided to forego any further surgery, although we had some reasonably good results over a long period of time, and those are well documented. The results overall I was not satisfied with, and I came into my office one morning and announced to my staff that we're calling off all further temporomandibular joint patients for surgery. But I had a long list of patients who wanted our services. I was well established as the temporomandibular joint surgeon in Nashville, Tennessee at the time. And I decided that I was going to see if I could figure out what no one else could figure out, because I knew there was no solution. Certainly surgery wasn't the solution. There were no non-surgical solutions. There were multiple procedures and things that were being done, the most common being the night guard, but everyone knows that is not effective. And then the story is, I won't take you through it again. It's like we went through the steps and actually figured out what everyone else had missed. Surprised me when I found out, with the help of my patients who gave me the key, what to do. I did that. It worked. I did 25 more. I did 50. Decided to see if we could put a patent on it, which took multiple years, actually 4 years, 2 more years to get the FDA clearance and approval. And now we're teaching this to other doctors who want to use the same tool and protocol to help their patients. But the point of today is, what I did is I selected out 17 patients from 2022 who had obvious significant damage to the temporomandibular joint, who in my hands or any other oral and maxillofacial surgeon who did temporomandibular joint surgery would have been a surgical case. And each one of these patients, I'm going to take you through a little history on them. I'm going to take you through a review of the x-ray, which is really what I want to see. I think this will be a teaching opportunity for viewers to actually see some really nasty temporomandibular joints. And then I'm going to read you their success stories. And some of these success stories are a little embarrassing, because I constantly tell patients, when I ask them to write a success story, I say, please don't brag on me. I don't need it. I don't want it. Just tell your story. Tell in your own words what happened when you went through using the device and protocol. And we're going to read some of those. We're going to read all of them on 17 cases. And I'll try to march through these as rapidly as I can, but not so rapidly as you don't pick up the meat of what I'm trying to show you, which is that significant damage to these joints, which with significant symptoms can be handled non-surgically by unloading the joint according to the proper protocol, according to the proper method. So let's go ahead and just start. And we're going to start out with just a normal case. Again, 2022, we had over 500 cases that we did successfully. Literally, we have a problem in the office. We can't get people back once they think their symptoms are gone. So out of those 500 cases, really only about less than half of them went through the entire 6-month protocol, because once patients think that they're fixed, I'm fixed, I don't need to go back. And that is very, very common around here. But basically, we do about 500 cases a year. And 2022, we had 140 success stories. I always wait until the patient can, in their own words, and at the time, they can claim subjectively that they have at least 80 to 85% of their symptoms, whatever the symptoms are, the total number of symptoms, diminished, decreased, or gone. And that is the point where I ask them if they would care to write a success story and take a little picture. And we have 140 of those. And out of those 140, I picked out the worst of the worst X-rays. That's what the selection process was, not the success stories. The worst of the worst X-rays, which would obviously, in my hands or hands of other oral and maxillofacial surgeons, been a surgical case. But we're going to start out with a normal case. This is just an example of a normal X-ray. This patient was patient in 2022. And I just want to point out, you have a normal position of the condyles within the glenoid fossa, and the surface of the condyle is well positioned, and it is clearly smooth, and it's basically a X-ray, a Panorex of a normal patient. This young lady, I'll just read her success just to prove that this is a case that would not have been a surgical case in my practice, a surgical practice. But this young lady says, Dr. Urbanek is very knowledgeable. The Urbanek device has limited the majority of my symptoms in just a few months. It's no longer painful to eat breakfast in the morning. I do not wake up with headaches and facial swelling. All right, so let's move into case number one. What I'm going to point out is really a good example of bad-looking joints. This patient is 50 years old. Symptoms that this patient, Tracy, came in with were history of headaches, earaches, jaw pain, shoulder pain, jaw locking, and inter-incisal distance was 45 millimeters. She could open lower side of normal. But look at these joints. They are certainly not the worst. This is kind of a normal appearing bony surface of a joint, but you can see this, what we call chicken's beak right here. This indicates that a large portion of the superior surface of this condyle has resorbed. This part is gone, leaving this, what we call in the vernacular, the chicken's beak. Much worse over here, and you can see the modeling of the condylar head, and all of this is generated by inflammation within the joint. If that isn't understood or said, I'll make that clear. Inflammation within the temporomandibular joint literally causes all the damage to the meniscus, all the damage eventually to the modeling, degenerative change, degenerative joint disease within the joint itself, all generated by the inflammation, chronic inflammation. This patient's success story is pretty long, so I'm just going to briefly read it. I came in with multiple complaints to include neck pain, ear pain, jaw pain, popping. That was somewhat, and my jaw was somewhat malaligned with headaches. To sum things up, 80 to 85% of my complaints are relieved. Back sleeping is easy. Breathing is easy. Hip pain is gone because I wasn't sleeping. Couldn't sleep on my back. No more eating ibuprofen and Tylenol like candy. My bite is correct. Headaches and jaw pain, neck pain are relieved. Both doctors and all their staff are very helpful. So that's kind of the general nature of it. I won't go on and read the entire thing. Next case, a little bit different. Case number 2 is a 39-year-old female with her history of headaches, jaw pain, shoulder pain, arm and finger tingling and numbness and locking, with neck pain going back 20 years and interincisal distance, max interincisal distance of 33 millimeters. She could not open all the way. Definitely, obviously, a surgical case, most likely a total joint surgical case. Again, to point these things out, you can see the chicken's beak here. You can see how flattened the head is rather than round. You can actually, on this x-ray, I believe you can see a little bit of the meniscus, although cartilage does not show up well on x-ray. But the degenerative change on the surface right here on the right side, this being the right side of this joint. So again, case 2, surgical case. And this patient states, let me move myself out of the way here a little bit. I have suffered with pain in my left jaw for over 20 years now. I've had a couple of dentists make me a retainer because they said I would grind my teeth when I was sleeping. It barely helped at all. In 2022, the pain became so bad when I would open my jaw, when I open the jaw would lock up, and it was so painful to open my mouth. Then I had pain run down my left shoulder into my hand. We can talk, I've talked before about how you get arm, hand, finger tingling and numbness. I would drop everything I touched. I went to the physical therapy and it barely helped. It was time consuming, costly. Finally, I went to the dentist and told him I could not deal with it anymore. He referred me to a TMJ. He made me a special device and it changed everything. I wear it when I sleep and the pain has been reduced dramatically. So that's what Lauren has to say, and Lauren missed the surgical experience. Next case, interesting case here. First, I just want to point out, and I don't want to get too off purpose here, but obviously this patient has a lot of missing teeth. I can tell you this patient did not use a mandibular partial denture, but had an upper partial denture before the x-ray was taken. But her sole occlusion was on these 2 first molars. This is Leslie, a 74-year-old male. In any case, look at these joints. We have flattening here. You're starting, this right here is a subcondylar cyst, which is caused by degeneration within the temporomandibular joint and degenerative joint disease. Look at the shape of this condyle as it's beginning to degenerate, bony loss. And Dan's success was I was referred by my dentist due to TMJ, and having followed Dr. Urbina's recommendation. Dr. Urbina is my associate. Treatment procedure, my pain level has all but disappeared. Bad joints would have been surgery before, would have been surgery for sure. Next case, right joint doesn't look too bad, but the left joint, look at this, total flattening. Most of the condyle is gone. You can imagine what that does to the bite, how it shifts the mandible over to the left when that occurs. Of course, over a period of time, the teeth will attempt to follow. That's a whole other issue of the orthodontic consequences of degenerative changes of the joint. But this is case number 4. It's Lindell, 60-year-old female. Original symptoms. Patient presents with headache, earache, jaw pain, neck pain, ringing, a subjective hearing loss, vertigo, shoulder and arm pain, arm, hand, finger tingling, and numbness with locking, and feeling that the teeth do not meet together properly. Just what I said, teeth do not meet together properly, and the headache going back 50 years. So we have a 60-year-old female who started having headaches when she was 10 years old, now has significant damage to this joint, obviously would have been a total joint replacement in other hands. And what does she say? She says, wow, what can I say except my TMJ device has lowered my daily pain levels to a point that I sleep great now. I have movement in my neck and shoulders that I hadn't had in years. Headaches are gone. I wouldn't take a nap or go to sleep for the night without it. Next case, this one is pretty profound. Look at the size of these condyles. Look at the lack of integrity of the surface of the condyle. Again, we're getting degeneration within the condyle, subchondral cyst right there. Very diminutive condyle. Takes years to get a condyle looking this degenerated. How many years? I mean, 20, 30. This case obviously has had pain for quite some time. The history of this patient, Wanda is a 75-year-old female and comes in with headaches, sinus headaches, mandibular pain, dizziness, and vertigo, headache going back 50 years with vertigo getting worse. Definitely, this would have been a total joint. In fact, probably both of these would have been total joint replacements, big operation, several days, at least a couple days in the hospital. Honestly, between the surgeon and the hospital and anesthesia fees, we're talking, depending on where you do it on the east or west coast and middle of the country, between $60,000 and $110,000 to do this kind of surgery. All told, somebody pays that. You pay it with your premiums. Your employer pays it. Wanda says, I have had headaches and facial pain most of my life. My dentist asked me to see Dr. Urbanek for the jaw catching and hurting. He knew exactly what the problem and solution was and is. He is correct in his assessment of solution. I'm very pleased with the result. The popping from my jaw is rare and the pain is gone. Very nice lady. I remember her really well. There's not much I can say. And believe me, I feel a little embarrassed sometimes reading these things. But I want you to celebrate along with me that what we've discovered here, what we use, is huge in the realm of treating temporomandibular joints successfully. It was what my vision was back 12 years ago, is trying to figure out what was really happening here. Next case. This is a good case of modeling and subchondral cyst formation. When you get long-term chronic inflammation within the joint, besides damage to the meniscus, which is always present. I've opened so many joints where the meniscus was just looked like a little piece of soft clay or something like that. Just a little piece of tissue, had no form to it at all. But eventually the chronic inflammation causes these large encroaching cysts within the condyle, which eventually leads to damage of the surface and internal surface of the condyle. Both of these, you see a little chicken's beak right there, meaning the surface of the condyle has been reduced significantly. This patient was Dr. Urbina's patient, and Tina says, when I first came here, I wasn't sure anything was going to help with the jaw and ear pain. After 2 weeks of wearing the device, I could already notice a difference. Within 3 months, I could believe it was possible to open my mouth without feeling pain. It's now been 6 months, and the ear pain and jaw pain are almost completely gone. I think so much, should say Dr. Urbina, but sometimes patients actually don't know who is treating them around here, and his staff for helping me. So this patient, Tina, came in with earaches, jaw pain, ringing, fullness, vertigo, shoulder pain, arm, hand, finger tingling and numbness, and difficulty opening. Her interincisal distance was only 30 millimeters. Definitely a surgical case. Next up is a 69-year-old female, Nadine Ray. Again, you can see the indentation of actually what happens here is the meniscus. When it gets pushed out in front, it begins to cause this little indentation. And then with the condylar head resorption, you get the chicken's beak appearance on both sides. This patient came in, Nadine came in with a history of headaches, earaches, jaw pain, neck pain, tinnitus, fullness in the ears, vertigo, shoulder pain, arm, hand, finger tingling and numbness, locking at 34 millimeters, couldn't open beyond 34 millimeters, and headache, excuse me, nope, not headache, jaw pain going back 40 years. Nadine says, as long as I can remember, I've never been able to open my mouth. I could not take a big bite of anything. I always had problems at the dentist's office. For years, I experienced jaw pain, shoulder pain, neck pain, ear pain, ringing, and just plain fogginess. Then, when I thought it could not get any worse, I started to have severe headaches. I'm so thankful to Dr. Urbanek and his staff, pain-free after 40 years. I would highly recommend Dr. Anthony Urbanek. As I said before, it was the answer to my prayers. Embarrassing, but again, it's a celebration. Next up, case 8 is 55-year-old female Laura. And Laura comes in with history of headaches, jaw pain, ringing in her ears, tinnitus, subjective hearing loss, fullness, shoulder, arm pain, closed lock at 30 millimeters, and headache going back 35 years. This woman could not open beyond 30 millimeters. Let's take a look at the joints. You can see the subchondral cyst forming here. You can see the diminished size of this condyle already in comparison to the other side, but you can see how the hockey stick is forming on this condyle. We'll show a much better picture of this later on, better x-ray. But the degenerative change here, she couldn't open up, definitely a surgical case. And Laura has this to say: my jaw had locked twice before and my dentist treated it with steroids. This last time it locked, the steroids didn't work. My jaw remained locked, so he sent me to Dr. Urbanek. Dr. Urbanek fit me with a device that he assured me would fix my symptoms. Headaches, ear pain, jaw pain, shoulder pain, ringing in the ears. After 4 months, my jaw slipped back in place and the symptoms are greatly diminished. Now, this case is a really interesting case, give you a little history. This patient came from about an hour and a half away from in Nashville. When I walked in the room and glanced at this x-ray, I knew immediately that this patient had undergone orthognathic surgery, but quite some time ago, because nowadays orthognathic surgeons like myself use plates and screws, and somebody using just wires would date the surgery quite a bit. But this patient, you can see, underwent a genioplasty, a reduction of the chin, sagittal split osteotomies, which these wires indicate back here, to reduce probably to bring the mandible forward, and then maxillary Le Fort 1 osteotomy, indicated by these wire sutures up here to hold the maxilla back in proper position. History is on Carolyn. Jaw pain, experienced flare-ups with increased frequency, reports headaches, ear pains, neck pain, fullness in the ear, subjective hearing loss, shoulder and arm pain, locking, and interincisal distance. Maximum opening is 31 millimeters. Look at these joints. Subchondral cysts, modeling of the surface, significant modeling here in degenerative joint disease on this side, modeling. There's no joint space at all. And that's one of the things that you can't really go by. The joint space, when you don't see a joint space, you can pretty much assume that there's quite a bit of degenerative change. But just because you see joint space doesn't mean that the joint is healthy. I think that's the point I want to make. But look at the degeneration on this condyle and in the area of the glenoid fossa. Same on this side. Patient couldn't open beyond 31 millimeters. Put her in a device, followed the protocol, and Carolyn has the following to say: the appliance relieved my symptoms more effectively than any other treatment, and I've had years of orthodontia and both upper and lower jaw surgeries. The physician is personable. I'm glad to hear that, but I know Dr. Rabin is very personable and takes time to address individual questions and concerns thoroughly. The office staff are all delightful to work with. The only negative aspects I experienced was the long commute from my rural home and navigating metropolitan Nashville traffic, for which the clinic bears no responsibility. Yeah, our traffic is getting pretty bad here in Nashville. Nashville is now a destination city. Next up is Sharon. Again, point these things out. Significant degenerative change here. At one point in time, I can promise you that this condyle was the same size as this condyle over here. But both are significantly degenerated. This one is getting into the hockey stick appearance with that chicken's beak here. Absolutely surgical cases that were treated non-surgically. Sharon says, when I came to Dr. Urbanek, I was suffering from headaches going back 50 years with neck pain, ear pain, and clicking when I opened or closed my mouth. After wearing the appliance for 4 weeks, I felt a bit of a difference after wearing for 8 weeks, night and day. I felt 95% better. My original symptoms have disappeared. Next up is Karen. Karen is a 15-year-old female, as you can see. She is not going to ever have third molars, but her second molars actually probably are going to end up impacted. And look at her joints. Not enough time to have significant degeneration, but you can see on this side there's significant decrease in the joint space. And Karen says she presents with right and left temporomandibular joint pain with locking. Recent locking for 2 months, has been in Invisalign recently, and just recently aborted Invisalign care because of the locking. I had locking in my jaw, which made it difficult to open my mouth, and I had headaches in the last few weeks. It has improved greatly, and I haven't experienced any locking since. Again, number 12, admittedly not the best x-ray, but take a look again, the diminutive amount of degeneration that went into this condyle. You can't even see a clear difference between the surface of the condyle and the surface of the glenoid fossa. Over here on the right side, again, it is a relatively poor quality x-ray, but you can see the modeling of the joint right there. This is a 51-year-old female, initial symptoms of headache, earache, jaw pain, ringing in the ears, fullness in the ears, arm, hand, finger tingling and numbness, with headache going back years, and a history of locking times 3 episodes of locking. Aria has this to say: instead of doing surgery, she went through the usual protocol, and for more than 10 years, I have been dealing with excruciating headaches, arm numbness, neck pain, and ear pain. I went to see neurologists, ENT doctors, and all kinds of doctors who prescribe medications for pain that is used for seizures. The medication only caused me more side effects than benefits. It was until my dentist referred me to Dr. Urbanek that I was able to experience true relief. My pain started disappearing, and more importantly, I stopped being drugged with the medication. This small device has provided healing, true healing of my body. I have to say that it is not a magic device. You have to be disciplined and you have to use the device as directed. Today, my pain is 90% gone. I wish I had met Dr. Urbanek 20 years ago. I have so many patients tell me that. Truly, so many patients say that, and it's a compliment. I take all the compliments. And again, to describe it in front of my colleagues, it is embarrassing. But again, the celebration is not about me. It's not about me. It's about the patients who have avoided surgery. And I'm a surgeon. I don't do surgery anymore, but I feel, and I felt 12 years ago, there had to be a better way. Had to be a better way. Next up is, and we're going to get to the end here pretty quick. We have 17 cases. Next up is 65-year-old female, Melanie. Her chief complaint was jaw pain, headaches, and ear pain, and also reported neck pain, limited mouth opening, and she could only open to 38 millimeters, closed to 38 millimeters. You can see easily the diminutive condyle. That's not how it was when she was born. And this one is, they resorb differently on both right and left sides. You're not going to see the equal changes on the joint between right and left side. That is for sure. But you can see how much this condyle has degenerated into the size of this, and this one has degenerated. This condyle used to have a much larger cap on it. But after many, many years, that's the kind of degeneration you see, and that would have been a surgical case. Dr. Urbanek listened to my complaints of constant right jaw pain, and I was not able to open my mouth. My mouth up and opened enough, enough to even take a bite of food sometimes. Now I no longer have any pain on my right side and can chew normally. He has really changed my life with this procedure. You can see how this condyle on this patient, who is a 65-year-old female, presents with chief complaint of jaw pain, headaches, and ear pain. Other than that, limited opening. And again, no, excuse me, I'm reading the wrong one. This is a 59-year-old female, chief complaint of limited opening and earaches, neck pain, ringing, fullness in the ears, and 30 millimeters of opening, max opening 30 millimeters. Obviously a surgical case. You can see significant damage within the temporomandibular joints. Sarah states, before I got my device, I had a constant aching pain in my jaw and cheek area. I would have to massage my cheek daily and put ice on it. I also had difficulty opening my mouth to eat some food, hamburger. After wearing the device for 8 weeks, I have improved 90%. I have no constant pain. Sometimes when I yawn, it feels a little pain. Another added benefit is that my ears used to stop up all the time, and that has not happened anymore. I'm so happy I found Dr. Urbanek. This is a typical hockey stick appearance, significant degenerative change. This is an 18-year-old female by the name of Sela. Presents with headaches, earaches, jaw pain, neck pain, tinnitus, subjective hearing loss, vertigo. And her interincisal distance is 50 millimeters. Significant damage to both sides. You can see the difference between both types of damage. This one is, had quite a bit of vertical bone loss. And we're going to show you an X-ray number 17. I saved it to the end, a very profound X-ray number 17. And the amount of degeneration here and lack of cortical surface on this side, and the diminutive changes on the right side. Sela says, after one bad dentist caused major issues, a round of many new dentists and specialists ensured to figure out the incredible amount of pain and swelling that I was experiencing. Finally, my new dentist, who was extremely thorough, said, I think it may be your jaw. She sent me to Dr. Urbanek, and he reviewed my case, examined me, and said I can help. He created what I call a mouth splint, and he calls it a device. I began wearing it as instructed. The swelling and pain decreased quickly within probably 2 weeks. After over 2 years of absolute hell and running around losing teeth, I finally had relief, significant relief. I continue to wear it nightly and will for the rest of my life, because the benefit I reap from wearing it is huge. If you are having issues in your mouth that you or your dentist or specialist can't quite figure out, call and make an appointment. Next up is Joyce. Again, same kind of situation, significant flattening, diminution, both sides, but you can see both sides are different. This side degenerated a little faster than this side. Initial history, chief complaint, ear fullness. Chief complaint, ear fullness, with other symptoms reporting as headache, earache, ringing in the ears, subjective hearing loss, fullness in the ears, arm, hand, finger tingling and numbness. Interincisal distance opening to 42 millimeters. It's the low side of normal. And Joyce has to say, I've been suffering with ear pain and headaches for over 20 years. Once I got my TMJ device and started wearing it, as Dr. Urbina prescribed, my symptoms began decreasing. After almost a year, it's hard to remember how I used to feel. I'm so blessed to have found them. Last case. And this one I wanted to show you because as I culled through these x-rays, and I just pulled out, nasty looking temporomandibular joints that would have been a surgical case, this one really caught my eye. This is a exquisite example of how subchondral cysts end up becoming hockey stick appearance to the condyle. If you can't see that, it's obvious. So this is a subchondral cyst formation, and once the anterior surface of this breaks down and all this bone is resorbed, then you're left with these hockey stick appearance to the condyles. This is a 46-year-old female. Chief complaint is jaw pain. Other symptoms reported as headaches, earaches, neck pain, tinnitus, fullness in the ears, subjective hearing loss, vertigo, shoulder and arm tightness, arm, hand, finger tingling and numbness. Maximum interincisal distance, 36 millimeters. This patient is named Kimberly. And Kimberly says about her non-surgical treatment, I had pain in my right jaw for the last 20 years. By the way, pain is related to inflammation, not necessarily how x-rays look. It started with the occasional pain when chewing and gradually grew to daily pain while chewing, biting, sleeping on the side. Over time, it became more difficult to open my mouth wide enough to bite into a burger. I dreaded the dentist appointments because having my mouth open for long periods of time was excruciating. I had a dental appointment coming up, so I told my dentist I couldn't do it because of the pain. I was afraid my only option for relief would be surgery until I was referred to Dr. Urbanek and his team. Thank you, Dr. Urbanek, for your kindness and for changing my life for the better. It's nice to be able to take a bite out of a burger and do other things that we take for granted. I'm a firm believer and recommend Dr. Urbanek. Well, that sums it up. And I celebrate each one of these patients. I hope I didn't bore you. I hope you learned something by looking at the x-rays. I did. When I saw that last x-ray, number 17, when I was culling through these x-rays, I spotted that and I said, that is profound. So the message is, besides the celebration and the fact that you don't have to do surgery, by decreasing the inflammation and getting a more normal fluidity to the synovium, and the chronic inflammation diminishes and dies down, the symptoms go away. I'm not going to go through how that happens again. It's on the other episodes. But for today, I would want to thank you for your attention. Again, I hope you learned something. I celebrate it with you. I celebrate it for my patients. If you'd like to learn how to do this, we have a course, an online course that teaches how to do it, teaches how to use the device and protocol. Our website is www.tmjservices.net. I can be reached at Tony Urbanek. I can be reached at Tony@tmjservices.net. And our Director of Marketing, Dr. Naomi, will be available if she wants to talk with you at Naomi@tmjservices.net. So for today, I look forward to our next time I can deliver an episode. I'm Tony Urbanek, and have a good week.